Chapter 38, Providing Wound Care and Treating Pressure Ulcers. These are the theory objectives for this section of the chapter. Okay, so there's a lot of different ways you can get a wound. Maybe you had some type of trauma. You hit something or something hit you or, you know, some type of trauma or whatever. A surgery, you get a wound from a surgery. Pressure, burns. Your wounds can be open or they could be closed. Open meaning the skin is broken, and so that wound is actually open. Closed meaning the skin is not broken. Um, Always remember, anytime that skin is one of our uh, ways to prevent infection. So when the skin is closed, it keeps different, it keeps things out. It keeps things in the body as well as keep things from getting in the body. So keeping things out such as bacteria and things like that. So when you have that skin broken from any type of wound or whatever, or if you open it via surgery or whatever, you're breaking that layer of protection, which means you can allow bacteria to enter into the body via that wound. So anytime a person has a open wound, that layer of protection is gone and they're at risk for infection because now bacteria can easily enter the body. Okay, so like I said, the primary functions of the skin: protection, like we discussed on the previous chapter. So protection from things getting into the body, so bacteria, whatever, keep things from getting into the body. It also serves as temperature regulation and sensory perception, so you can sense things. Like if you touch something, you can sense things. You have your epidermis, which is the outermost layer, then your dermis, which is just the under the epidermis. And then the subcutaneous tissue, although it's not actually a part of the skin, is usually discussed when you're referencing the skin. And so the subcutaneous tissue um, is just under the skin, and it's also referred to as the hypodermis. So remember, we said you can have different types of wounds. They can be open or they can be closed. Open meaning there's a break in the skin. So you got some type of ulcer or wound that's open, a skin tear, incision, or laceration or something. The skin is actually open, whereas a closed wound would be when the skin is not broken. So that could be a bruise, a sprain, or something like that, um, because the skin is not broken with those type wounds. Okay, so you can have partial thickness wounds or you can have full thickness wounds. Your partial thickness wounds, those are going to be superficial wounds. So that's just going to be like the loss of the epidermis and possibly the dermis. So remember those top two layers that we discussed. Full thickness wounds. Full thickness wounds, we are actually down to possibly we are down to at least subcutaneous tissue and possibly down to bone and muscle when we're talking about full thickness wounds. With your full thickness wounds, you can get necrotic tissue or slough, which is dead tissue. And in order for the wounds to heal, that all dead tissue has to be removed from that wound for it to be able to heal appropriately. All right, so your wound has three phases of healing. First, that's that inflammatory response, and so with the inflammatory response, what's happening? We'll talk more in detail about that inflammatory response, but um, it's a localized protective response when you have an injury or some type of destruction in the tissue. And so that's what happens in that initial phase. And we'll talk more about what you'll see in that inflammatory response. The second phase will be your proliferation or the reconstruction phase when the wound is actually reconstructing. So it's going to start building up new tissue or whatnot. And then your third phase will be your maturation or your remodeling phase, um, when the skin is actually uh, remodeling or building itself back up. Um, a lot of times, uh, the replacement tissue may not have the same functional characteristics as the tissue that you lost. And so generally, fibrous connective tissue is not the same as the initial tissue that you lost. So, like I said, with inflammation, that's a localized protective response, and that occurs um, initially when the injury occurs, and it lasts for about 1 to 4 days during this phase. So, during the inflammatory phase, you're going to see swelling or edema wherever you were injured, redness, also called erythema, because you're going to have increased blood supply to that area. Um, it's going to be warm to touch, probably some pain in that area, possible loss of function depending on the extent and type of injury it might be. You might lose the ability to use that area of the body for a bit. Okay, so the proliferation stage. So that one starts around the third or fourth day and lasts for about 2 to 3 weeks during the proliferation stage. And so that's what I said was the reconstruction phase. So you will have collagen will stimulate new tissue growth. So you'll start to get new tissue growth. You want your wound beds to be like a nice beefy red or a deep pink color. If you have necrotic tissue or eschar, that black leathery substance, or slough, it's a tannish color goo. All that is dead tissue. Your wounds cannot heal without with that dead tissue in it. And so all of that will have to be debrided. And so the doctor or healthcare provider can cut that away, or some dressings that they order may have some debriding abilities to them to get that dead tissue out of there, because it won't be able to heal um, uh, with that in there. And so then your full thickness wounds then can begin to closed by contraction, and that just means the wound spontaneously heals. But you need to keep that wound clean. So whatever the order is for cleaning, you're gonna clean it with that and apply your dressings as ordered, um, so that healing can take place. And then your final phase is your maturation phase, or your remodeling phase. And so this phase starts around the third week. And depending on how bad the wound might be, it can take up to 2 years, especially if it's a full thickness wound that's maybe down to bone and muscle or something. It could take up to 2 years to try to heal this wound. But of course, all wounds don't necessarily take that long, but it just depends on the type of wound it is, um, and the extent of the wound injury, and how you're healing it, um, and what type of dressings and things like that we might be using. And so during this phase, you're probably going to get some scar tissue. Um, that's gonna be developing over um, where the skin was at one point. Okay, so um, you have different types of wound healing. You can have wounds that are healing by first intention, second intention, or third intention. So a wound that's healing by first intention would be, if it's primary or first intention, it would be like a surgical wound that's closed by sutures or staples or something like that. And so those are closed up, and it'll heal like that. Now, a wound that's healing by second intention, um, a second intention, that's when the wounds are not approximated. Approximated means they're closed with staples or sutures or something. But second intention, that wound is not approximated. And so it's left open to heal. So like a pressure ulcer or something like that. And so we would be applying some type of dressing to that wound for the healing to take place. And then a wound that's by third intention, that's healing by third intention, that would be where you would have like a delayed suturing of a wound. So sometimes, like maybe with an abdominal wound, they might leave it open to drain and then they'll suture it later. And so that would be third intention or tertiary intention. Um, wounds that are left open to heal, they're at higher risk for infection than wounds that are healed by first intention. Now, wounds that are healed by first intention, they do have some slight risk for infection because you have opened or broken the skin during the surgery process, but closing it so they're exposed to the um, open area uh, for a shorter period of time because it'll be closed with some type of suture or staple after um, the surgery is complete for first intention. But like secondary intention and third or tertiary intention, those wounds will be open, especially your second intention wound healing. Those will be open for a longer period of time. And so, therefore, bacteria has more time to be able to enter the body with those. And so, those wounds will be higher risk for developing some type of infection because that first layer of defense, the skin, is open or broken. Okay, so a lot of different things can affect wound healing and how fast a wound may heal or not. For example, a person's age, um, the very young, the very old, um, may have more of a difficult time because, for instance, when we talk about the very young, your newborns and your infants have thin, fragile, sensitive skin. And so that puts them, more at risk for friction and pressure that may cause breaks in the skin. You're very old, as you begin to age, the skin again starts to become thin, dry, and wrinkled. And so there's a diminished elasticity, circulation, um, and those and also decreased immunologic effect or activity as well. And so the combined effect of all these changes increases the risk for skin irritation, skin tears, pressure ulcers, infection, things like that. Nutrition that can impact how well, or nutrition and hydration can impact how well a person wounds may heal. A well balanced diet and adequate fluid intake are important in maintaining healthy skin. So, malnutrition results in loss of subcutaneous tissue as well as lack of vitamins and minerals that are needed to maintain healthy skin. And so when a person is malnourished, the skin may be dry and vulnerable to skin breakdowns. Hygiene can also impact how well a wound might heal. Healthy skin requires cleaning regularly, and so failure to clean the skin results in the accumulation of things like sweat, bacteria, and dirt. And so all of these things can clog the skin pores and lead to skin infections or infestations of some sort or whatnot. So you want to avoid excessive um, skin cleaning because excessive scrubbing and bathing may cause the skin to become dry and irritated. And so lubricating agents should be used to assist with keeping the skin moisturized. So also your environment can impact um, how well a wound might heal. The sun, the wind, any allergens around, any infections, agents in the environment, any chemical irritants. If you're working in an area that has a lot of chemical irritants, that could be, a factor. All these things have the potential to cause some type of skin damage. Other things that can affect um, how well a person, if you have poor circulation, such as peripheral vascular disease, that can impact how quickly your wound might heal, because if you have poor circulation, remember the blood carries oxygen and nutrients, and so if we have poor circulation and we're not getting that oxygen and nutrients that we need to that area, that can impact how well that wound will heal. If you have decreased immune systems, people, cancer patients, taking chemo, HIV patients, patients with decreased immune systems. So that can impact how well the wound heals. If you have decreased liver function, decreased lung function, lungs, because you're not getting oxygen out the to the different areas of your body. If you smoke, that can impede your ability to have good wound healing. Certain medications that you take, for instance, steroids, because steroids, they're used to decrease inflammation. And so remember, we said inflammation is that first phase that we would see. And so steroids might mask the signs of a wound infection because they inhibit the inflammatory process. So you don't know that an infection is occurring. And so you don't treat it properly, because if you're taking steroids, then you're not identifying that inflammatory process, because the steroids can mask that inflammatory process. If there's infection present in the wound, that can impede wound healing as well. So you have to get that infection out before wound healing can take place. Some signs and symptoms that a wound might be infected: the patient might have a fever greater than 101 degrees Fahrenheit. They might have a feeling of malaise, so weak and tired. The drainage, is it green? Is it purulent? Is it odorous? So check your drainage out as well. Is the area around the wound, which is called the peri-wound, is that red? Is that swollen? Is that warm to touch and inflamed? Um, you know, is it hot skin or whatever? Do that if it's like a extremity, do they have a loss of function in that area? Some other things that can impact wound healing also, if you've got chronic diseases that impact circulation, such as your diabetes or some type of cardiovascular disease or something like that, those things can also slow the wound healing process. So a lot of different things can impact how quickly or how slowly a wound might heal. All right, some things to look for or be aware of when you have wounds. So, say for instance, you had a surgical wound that was closed by a suture or incision or something. Um, Dehiscence, and so dehiscence is when that incision spontaneously opens, and so for instance, say I had an abdominal incision that was closed with sutures or staples or something like that. Sneezing, coughing, things like that that put pressure on that area can cause that wound to dehisce, meaning it will open up. Evisceration is when I have that wound opens up, but then I have an internal organ that protrudes through that incision. So, an internal organ is protruding through that incision. And so that is an emergency. So if that happens, if you have a wound that eviscerates, you want to place the patient in a supine position, place large sterile dressings over the eviscerated organ. You want to soak the dressing with sterile normal saline. So you're going to do sterile normal saline with a sterile dressing over that viscerated organ, so the organ that's protruding through. Notify the surgeon immediately and prepare, because that person is going to be going back to surgery. So you want them in PO, because they're going to be going back to surgery. Okay, question one: which phase of healing begins on the third or fourth day after the injury and lasts 2 to 3 days? And so your answer here is going to be proliferation. And so proliferation begins on the third or fourth day after the injury and lasts for about 2 to 3 weeks. Okay, question 2. Which of the following is not a factor in wound healing? So the answer here is going to be number 4. The type of wound is not one of the factors that affect how fast that wound might heal or not. Remember, we talked about age, medications, and lifestyle as being issues that can impact your wound healing. These are the clinical objectives for the next section of this chapter. So there are a lot of different ways or types of wound closures that might be used. You're probably most familiar with sutures and staples to hold the surgical wound together until the wound heals. Make sure you watch that video that I've posted on Blackboard on staple and suture removal to see how that process is completed on how to remove that. Um, uh, Silver wire clips can be used. Sometimes there's large retention sutures. So if the surgeon believes there is a chance that the wound might dehisce, remember we said spontaneously open, then they might use those large retention sutures. Steri strips can be used if a wound is small. Sometimes also when they take out staples or sutures or something like that, if it looked like it might possibly dehisce or whatnot, they might put some steri strips on there as well to just kind of help hold it together a little bit more. And Dermabond, which is a synthetic, like a non-invasive glue that many of you might have used as well. So when you have staples or sutures or some type of wound closure or whatever, you want to make sure you assess the wound every shift. You should be assessing that area every shift. If you know, if say abdominal or something like that, a lot of times they want to, well, most of the time they want to encourage coughing and deep breathing to prevent pneumonia or respiratory complications, and so it might be painful for them or whatnot. So you want to encourage the patient to use a pillow or a folded blanket or something like that to splint that area so that they're not putting so much pressure on the suture on the suture or the wounds when they're doing their coughing and deep breathing or whatever. So you have different types of wounds here. You have the red wounds, the yellow wounds, the black wounds. So remember, we said in order for that wound to properly heal, you want that wound to be like a nice beefy red or deep pink or whatnot so that it can properly heal. Obviously, you're going to be, doing your dressings or whatever. You're going to keep, cleaning with whatever's ordered to clean with and providing your, applying your dressings or whatnot. But those yellow wounds with the slough in it, or if it's draining a lot, um, we got to get that slough out of there so that it can, heal properly. And so, especially if it's draining a lot, the dress type of dressing you choose will be one that's going to be more of an absorbent dressing to you want a moist wound bed for healing, but if it's draining a lot, it's going to prevent proper healing because it can cause that peri wound or the which is the area surrounding the wound. It can cause it to get macerated and break down even further if it's draining a lot. So your dressing that you'll choose will be an absorbent dressing. If it's a black wound, necrotic tissue, that eschar in there, it cannot heal until you get that necrotic tissue out of there. Slough and necrotic tissue are all dead tissue. And so, like I said, that can be removed by the healthcare provider scissors or the type of sometimes with their slough, the type of dressing that they use, they can have some debridement abilities to certain dressings or treatments that they might order. Okay, so sometimes wounds are connected to drains to allow any blood or body fluids to be excreted from the body. An active drain is connected to suction. A passive drain uses gravity. So the drain can be connected to suction, or it could be um, be drained via gravity. And so they'll put a drain in to prevent buildup of blood or body fluids, which can cause an abscess or a fistula in that area. So that's why they'll put that drain in there. Um, I did post a video on Blackboard about wound drainages, specifically a Jackson Pratt, on how to empty it and take care of it or whatnot. And so make sure you take a look at that video as well. Um, if the person has, different types of drains like that are connected to suction, like your Hemovac and your Jackson Pratt, you want to empty that every shift. You want to make sure you're emptying that every shift. The Penrose drain is a flat rubber tube, and so that one is just being drained via gravity. And so you'll have your drain sponge surrounding the area to try to catch any drainage that might be coming out via that Penrose drain. But if you do have one that's going via suction, you want to make sure you empty that every shift. Okay, so choosing the right type of wound dressing is important to maintain your wound bed. Like I said, you want to make sure you have a moist wound bed, but you don't want a lot of excessive um, drainage, because if you have a lot of excessive drainage, then it can cause that peri wound or the area surrounding the wound to become macerated and begin to break down. So if you have a wound that's draining a lot, you want something that will help absorb the drainage. If you have a wound that is very dry, then you'll want something that will moisten it. So you, as the nurse that are changing those dressings, need to make sure you're watching these different things so that you can properly report to the physician um, changes in that wound. So you want to report immediately if you having profuse drainage from that dressing. Is the dressing that we're using not appropriate? Is there a lot of pain that's not being controlled by the pain meds? The other thing too with that pain, you always want to make sure you check um, if that. A lot of times, patients with a lot of pain may need pain medication prior to the dressing change, and so then you would administer that pain medication depending on what route, 30, 45 minutes prior to doing the dressing change. Um, so that the dressing change is not as painful for that patient. And check, monitor for any abnormal vital signs as well. You know, ensuring that they're not developing any type infection or things like that. So making sure you're monitoring, because you are the eyes, because you're there changing that dressing on a daily basis. And so if something's not working, then the physician needs to know that. So there's a wide variety of different types of dressings that materials that you can use. These are just a few. Obviously, your dry sterile gauze, a telfa or some type of non-adherent dressing. If you need something that won't stick to the wound, then you might choose one of those. Your surgical or your ABD pads, the abdominal pads, that's what your ABD pads, those thicker pads are. A foam dressing if you want to absorb drainage more. A transparent film dressing that can stay on for 3 to 7 days. A hydrocolloid dressing like a Duoderm or something can help maintain a moist wound bed. And so that hydrocolloid is not for wounds that's draining a lot. It's just like a superficial wound or something like that, and it can stay on for about 3 to 5 days. Okay, so when you're cleaning your wounds, obviously you're going to clean with whatever solution a doctor has ordered to clean that wound with. So it just depends on what's going on with the wound, what type of solution it might be cleaned with. A lot of times maybe it's, a normal saline, but if there is some type of infection in the wound, then they might be cleaning with some type of antibiotic solution or something like that. So you're going to pay attention and clean with whatever is prescribed. Your wound cleanser should be warm because cold cleansers or if you use cold solutions, it'll decrease the temperature of the wound, which will decrease or slow the wound healing process. So remember, heat increases blood supply to the area, which can reduce pain and reduce pressure on the nerve endings in that area. Whereas cold, it decreases the blood supply to that area, which will decrease swelling, help with decreased swelling, decrease pain in that area. And so we don't want to decrease blood flow to that area. We want to increase blood flow to that area because that's going to bring the nutrients and the oxygen we need to that wound. So you want to make sure you use warm um, cleaning solutions when you're cleaning the wound. So remember I said whenever you have any dead tissue in that wound, the wound cannot properly heal until that dead tissue is removed. And so the removal of that dead tissue is called your debridement. And so you can debride a couple of ways. Like I said, the healthcare provider or physician can debride with scissors or forceps, and they can do it in the operating room or they can do it in the patient's room. It just depends on the size of the wound and what needs to be debrided, whether it needs to be in the operating room or the patient's room. So the physician can do it, or certain dressings that you order will have enzymatic uh, effects and allow that wound to be debrided based on the dressing that you choose. And so the wet to dry is actually considered a debriding dressing, but it's not really used very much anymore because the idea is we put the dressing on wet, and then when it dries we pull it off, and it will pull off all that dead tissue. However, a few different things happen with that. Not only does it pull away the dead tissue, it also pulls away the good tissue when you do that. Also, it's very painful for your patient, and so we don't want to cause more pain to our patients. And a lot of times, because it does cause pain to our patients, the nurse might wet it with saline or whatever to pull it off so it's not so painful, which then uh, takes away the debriding effect. So this one is not widely used anymore as a debriding dressing, but there are some different uh, dressings or treatments that they can order that will have some type of enzymatic or debriding effect. Okay, so there's a lot of different ways you might secure a dressing as well. You might use Curlix or Conform or Ace Wraps or things like that. Remember, when you're wrapping an extremity, you want to wrap from the bottom up because we want to promote blood flow. So blood flow back to the heart. So if I'm wrapping the leg, I'm going to start at the ankle and work my way up, or the bottom up, wherever I'm starting from. Same thing with the arm. If I'm wrapping the arm or whatnot, I'm going to work my way up towards the heart because I want to promote blood flow going back to the heart. You have different type Montgomery straps. Montgomery straps are uh, a way to secure your dressing in place, and it prevents reuse of tape on the skin. And so there is a picture of the Montgomery straps in your book as well. But what you do is, so you would, put the tape on once, and then you can tie your dressing in place. And then when you need to change the dressing, you just untie and change your dressing and then tie it back up. And so you don't have to keep putting tape on, taking tape off with those Montgomery straps. Binders can be used. Remember, I said, you can do splinting or things like that to prevent tension on your wounds, well, sometimes they'll order binders to try to decrease tension in an area and decrease your risk for dehiscence as well. And obviously, tape, we might secure dressings on with tape or elastic bandages or different things like that. So there's a lot of different ways we might, things that we can do to try to secure dressings in place. So a negative pressure wound therapy, you might have heard it called a wound vac or something like that. So your wound vacs can be good for wounds that are difficult to heal. And so it involves a suctioning device. And so the suctioning device is attached and institutes negative pressure at the wound site. And so what it does is it suctions out fluid from the wound and at the same time increases blood flow to that area. So remember we said blood carries nutrients and oxygen to the area. And so by bringing the nutrients and oxygen to the area, that can help promote wound healing and also getting out all that excess fluid in the wound. And so it increases the development of the granulation tissue, which speeds the healing time and reduces hospitalizations. And I've seen, you remember I said some of these wounds can take up to 2 years to heal. And I've seen people with wound vacs that can take significantly less time to heal by using this negative pressure on the wound. Okay, so heat and cold or hot and cold applications. So remember we said reasons you would use heat. Heat is going to improve blood flow to the injured body part. And so you're going to get that blood flow to that body part, which is going to bring nutrients and oxygens to the area. Cold is going to decrease blood flow to that area. And so that's going to decrease your risk of swelling. So when you have cold, that's decreasing the blood flow to the area. So remember, anytime the first 24 hours after an injury, you need cold to decrease the risk of swelling to that area because cold is going to take blood flow away from the area. So the first 24 hours after an injury, you want cold, not heat. So a lot of times people use heat to relieve pain, reduce congestion in that area, relieve muscle spasms. Heat's often used with people with musculoskeletal areas for those different reasons. It helps promote comfort, elevates the body temperature. In your book, there's some contraindications, box 38.4 for heat and cold applications. For example, for heat, it says heat should not be applied over the area in which active bleeding is occurring because it will increase the bleeding. Heat to the abdomen is contraindicated if there is a chance that the patient has appendicitis because it may cause the appendix to rupture. And if a patient has a cardiovascular problem, it is unwise to apply heat to a large part of the body, causing massive vasodilation that may divert blood supply from a major organ. As far as contraindications for cold, cold is not applied to an injury area if it is already edematous because it will slow circulation and prevent absorption of interstitial fluid. When neuropathy is present, cold is not applied because the patient is unable to determine whether the tissue becomes too cold. And if the patient is shivering, cold is not applied. Shivering raises the body temperature. Okay, so you want to keep those things in mind. Also, when you're using cold applications, you want to make sure you apply a barrier between the skin and the cold application. It doesn't have to be anything thick, it just has to be a barrier because you don't want frostbite to occur. Also, with your heat, make sure you don't leave it on there for extended periods of time. Person shouldn't put a heating pad on and go to sleep and leave it on there all night because we don't want to cause burns or anything like that. So like I said, the cold is going to decrease blood flow to the injured part. So that's going to help decrease swelling, which will also help decrease pain, decrease cellular activity, which can lead to a numbing effect for these individuals. Um, you want to use it in a compress, ice bag, or a hypothermia blanket or something like that. Also, like I said, you want to make sure you place a skin barrier or a barrier, some type of barrier between the skin and the actual ice bag to prevent frostbite. Doesn't have to be anything thick, just some type of barrier between the skin and the ice pack. Um, 15 to 20 minutes, 15 to 20 minutes every hour for the ice pack. We're not going to leave it on for extended periods of time. Question 3. Kara's patient is going home with sutures. When are sutures usually removed? So the answer to this is 3, 7 to 10 days is when they're usually uh, removed. But you should have a doctor's order before removing them. Okay, question 4. Eric is about to change a dressing on his patient. Which of the following is true regarding dressing changes? So the answer here is 4. Wounds should be cleaned with warm water. Remember, we said the cold solution slows the healing process. And then question 5. Eric's patient has an order for cold compress therapy. How long can the cold compress therapy be applied? The answer here is 20 minutes. So cold compress therapy you got a max of 20 minutes at a time.